Hemolysis is the process of red blood cell breakdown, releasing hemoglobin into the plasma. The term is derived from hemo, meaning blood, and lysis, meaning breakdown. There are two main types of hemolysis. Physiological hemolysis is the normal destruction of red blood cells after their 120-day lifespan. Pathological hemolysis is the increased and premature destruction of red blood cells. Physiological hemolysis occurs when normal red blood cells are destroyed after completing their 90 to 120-day lifespan. About 1% of total body red blood cells are destroyed and synthesized each day. Aged erythrocytes are destroyed primarily in the spleen. This is due to low oxygen supply, which favors cell destruction. Additionally, IgG antibodies and the exposure of outlet phosphatidylserine on the cell surface signal splenic macrophages to recognize aged cells. Most aged red blood cells are broken down in the spleen, a process called extravascular hemolysis, accounting for 90% of destruction. Intravascular hemolysis, about 10%, happens within blood vessels due to trauma to red blood cells. Pathological hemolysis involves the premature destruction of red blood cells before their lifespan is completed. The rate of erythropoiesis increases in response to the rate of hemolysis. If red blood cell lysis occurs between 31 and 90 days, the bone marrow can compensate, which is characteristic of a hemolytic disease. If the red blood cell half-life is less than 30 days, it leads to anemia, known as hemolytic anemia. Clinical findings of hemolysis include pallor, mild jaundice from increased indirect bilirubin, and splenomegaly. Other signs can be bilirubinuria and, in chronic cases, gallstones. Lab findings for extravascular hemolysis show increased unconjugated bilirubin, increased urobilinogen in urine, and splenomegaly. Peripheral blood film may reveal polychromasia with spherocytosis. Intravascular hemolysis lab findings include hemoglobinemia, decreased haptoglobin and hemopexin levels, hemoglobinuria and hemosideronuria. Fragmentation, polychromasia, and spherocytosis may be seen on peripheral blood film. Lab findings related to increased red blood cell production, common in both intra and extravascular hemolysis, include reticulocytosis and erythroid hyperplasia on bone marrow examination. Tests to diagnose the type of hemolytic anemia include the Coombs test for immune versus non-immune causes, hemoglobin electrophoresis for hemoglobinopathies, and G6PD detection for enzymopathies. Additional tests are the osmotic fragility test for membranopathies and the CD55 and CD59 test for paroxysmal nocturnal hemoglobinuria, or PNH diagnosis.